All right, 11.4, Essex-Windsor EMS 2020-2021 response experience. Chief Krauter is going to bring that report forward.
Thank you, Warden, and through you to County Council. So the report before you, the purpose of it is to give some background and information on the performance and the experience of Essex-Windsor EMS for the period of January 2020 to September 2021, and also some other historical data and performance as well. Just as a reminder, we use the electronic patient care record platform to compile the data and research the data. We also use open data sources, especially now through COVID and over the past 2 years. We utilize Windsor Essex County Health Unit, Critical Care Services Ontario, Ministry of Health databases, and we refer to the 2018 10-year master plan that was approved back in 2016 or 2019. Combining all these different pieces of data and sources of information allows us and the County of Essex to plan and prepare for informed decision-making processes that results in the service delivery changes and alterations or enhancements. As we know, over the past 2 years now, COVID-19 and the associated impacts have been considered and understood. They may have improved back in 2020. I reported, I believe, improvement in offload delays, an improvement in resource utilization, and improvement in response times. And that was early in 2020. If we look back at that in 2020, we were in lockdown. There was nobody on the roads and call volume was very much low and hospital utilization was low. But in 2021, the lockdown ceased. The communities began to open up and people started moving around. And we must be cognizant that since 2020, the early 2020, the healthcare system was shut down as well. And now we're still addressing the collateral damage of COVID, such as healthcare backlogs, decreased capacity within hospitals, rates of infection that fluctuate from day to day or week to week, and other anomalies or pressures not experienced in the early waves. I do want to talk about call volume. As I normally do every time this time of year, I do talk about call volume and where it's going. I do want to make special note that on page 3 of my report in the graph, the 5-year average percentages are incorrect. And I will correct those as I speak to them across the board. So the code 1 to 4 volumes in 2020 are projected to increase about a 1.89, or if we're going to round it up to 2%. Conversely, in 2020, I reported that there was a decrease of 5.4%, but the 5-year annual average increase of call volume, code 1 to 4, it's projected to be at 2.6%. This is consistent with the guidance and recommendations of the 10-year master plan. The chart below, indicated by municipality, and I'll do this, and if you want to mark it in, it was brought to light yesterday to me after the report was published that these percentages were wrong, much on the high scale. Amherstburg, your 5-year average is 3.18%. Essex, 2.25%. Kingsville, 4.8%. Lakeshore, 2.4%. LaSalle, 3.5%. Leamington, 1.6%. Tecumseh, 0.43%, Windsor 2.87%, and that gives the Essex County average 5 years 2.6. Again, very consistent with what the ORH master plan recommended and predicted we would be going at. So we're still sticking around that 2 to 3% increase. Response times. As I'll be bringing another report probably at the next county council meeting about the response time, lane ambulance response time standard, and how we have to report that every year. But the response time standards, and it's spelled out how we measure that. This year, it is not favorable. Due to COVID in both 2020 and 2021, the targets have been very difficult to meet, and for various reasons. You can see in the chart that our sudden cardiac arrest in 2021 were projected to be at 50%. Our target's 55%. CTAS 1, 68%. CTAS 2 is 83%. CTAS 3 is 88%. And CTAS 4 is 86%. And CTAS 5 is at 86%. Why? Well, we have a lot of issues right now in 2021 with call volumes increasing, backlogs within the hospitals, increased offload delays and numerous pressures that neither can be predicted or understood at this time. We do utilize, though, I have to make this very much important, we utilize both our neighboring services for mutual aid, and we also utilize our local fire departments under the tiered response agreements. I want to reassure people that when it becomes a life and death situation or a life and limb situation, we have an emergency service, whether it's us or fire services, that is going to be there within minutes to respond to it. I just want to reassure, I don't want to create any fear and anxiety, but we do have that covered. I predict that as we move through COVID, this is going to get very much improved. I also want to state that this isn't just an Essex-Windsor EMS problem. This is also a problem across the province, across the region. Just as an example, this past week or yesterday or the day before, Chatham-Kent experienced issues where we had to, for about 20, 25 minutes, place an ambulance in Tilbury to cover off part of Chatham-Kent. We also placed an ambulance at St. Joachim. Why did we do that? We had the resources available. But we continue to have the partnerships with our neighbors and our partnering services across the board. Another measurement of response times is average response time. That's pretty simple. The CTAS one is much more of a convoluted formula that the ministry has put into place, but the average one is you take your calls and your average response time. You can see that in 2021, they are increased or projected to be increased, although slightly compared to the targets of CTAS response time standards. But again, that's with the impacts that we're seeing with COVID. We're seeing people utilize hospitals, block beds, increased capacity, all of that stuff that impacts us. That gives me the segue to ambulance offload delays. That's been a long-going issue that we've been addressing ever since I've been chief and well before that back in the 2000s. The frequency of ambulance offload delays, though, have been reducing year over year. I'll take 2020 kind of out of the mix because of COVID. But if you look at 2018, I'm looking at Appendix 2, you can see where we peaked with our ambulance offload delays in 2018. 2019, we dropped, and even in 2021, we're projected to be lower than 2019 and 2018, and more in line with what we experienced in 2016. But ambulance offload delays are still an issue. If you look at the chart, offload hours per year, we're projected to be at 26,000 offload hours in 2021. This cannot be sustained. We're working with Erie Shores, Windsor Regional, Ontario Health, and our dispatch center to create diversion protocols, and we're utilizing our other services such as VPN so that people can get the right care at the right time and at the right place. But the ambulance offload delay increase is, again, decreased capacity within the hospitals, increased call volume that we haven't been used to over the last 18 months, and increased walk-in traffic to the hospitals. You can't just say ambulance traffic, you also have to contemplate walk-in traffic. The other thing that came to light about a month ago with Windsor Regional Hospital and Erie Shores, they implemented a new data charting system, electronic system, and that has somewhat, I don't want to say, it slowed down the effectiveness of flow within the department, but we're seeing gradual improvement with that across the sector. The other thing is the backlog of primary care. If anybody has been trying to get hold of the primary care physician over the last 18 months, it's either by cell phone, video phone, and very much no face-to-face visits. That backlog is impacting us back to the other way, where people are either seeking 911 for their care, or they're going to the emergency department to seek their emergency care or their primary care. We continue to work in our strategies with our dispatch center, Ontario Health, and our hospitals. We meet daily to see how we can improve flow. We meet daily to see what the bed capacities are, not only in our region, but across the Southwest, including London and into Toronto. We talk to the acute care hospitals constantly and our local police services. As you're probably full aware with your local services, the police departments and mental health calls have increased, not only with ambulance service, but with police services. And unfortunately, police services are starting to transport people to the emergency departments that are in crisis. There's no medical need. It's a mental health issue, and they are transporting them, trying to get them to the right place at the right time. 10-year master plan and the recommendation implementation. If you recall, back in 2019, we approved the 10-year master plan, and there was numerous recommendations and kind of key milestones that we would meet over the next 10 years to make us both efficient, effective, and provide a very safe service within the community. Some of those we brought into effect over the last 2 years because we got opportunities. Last year, we got Ministry of Long-Term Care funding for 4 years, 100% funding, and that's where we implemented the Community Paramedic Long-Term Care Program. This is where we hired full-time paramedics who address the needs of people that are waiting in their homes before they seek long-term care beds and to keep them out of the emergency department. That went into effect last year. This past year, what also came into effect, which Essex County Council approved, is the Mental Health and Addictions Response Team. We got that up and running this year. We're making connections with a vast amount of our citizens and clients in the community at the scene and getting them connected to the right place at the right time. One of the other pieces that ORH recommended, and this is on page 7 of the report with the graph, was the redeployment of resources that we staff. If you look at page 7 of the report, you'll see the 2018 deployment plan, and you'll see that there's a blue and a green line that kind of waves up and down. That was our call volume back in 2018. The purple columns is how we staffed ambulances, and it was very much flat. So ORH recommended that we change that to what you see on page 8 in that graph. We had every intention of doing that in May 2020. If you recall, COVID hit March 2020. To make a major deployment plan in May of 2020, in the middle of the beginning of COVID, would have disrupted the service way too much. We waited almost a year to put this deployment plan into place. And if you can see it, the wavy line, the call volume, hasn't really changed. It's still there. If anything, it decreased, but the wave was there. The purple columns is how we staff ambulances. You can see that the purple columns capture the call volume. Yes, we moved ambulances from night shift, but we put those ambulance resources on the day shift to cover the demand or the need for the service. What we couldn't predict, what ORH did not predict in 2018, 2019, is a global pandemic. What we didn't predict in May of 2020 is that in May of 2021, we would be coming out of lockdown. Everybody would want to explore everything. Our call volume would go up, but our healthcare system was still backlogged. We couldn't predict that. And unfortunately, some of the volumes at spikes during the day do fluctuate and create where we don't have enough resources to capture the demand. We're addressing that. We address that each and every day with our offloads, with our processes, offering overtime to paramedics. We've made different pieces so that paramedics can carry their overtime not only for a year, we've made exceptions to the rules so that they can carry their overtime because we know they can't get time off. But we're offering all this stuff up so that we can keep the ambulances staffed. Unfortunately, call volume is very difficult to predict on a minute-by-minute basis. We're pulling out all the stops to make sure that we have the right resources at the right time and at the right place. But ORH, we are following that, and it is starting to work. Things are starting to settle down. We understand there has been some social media traffic talking about where resources are lacking. We haven't experienced code blacks in quite some time. I didn't want to use the term, but it came out. But we don't track that. It's difficult for us to track it. It's a manual type of tracking where dispatch tracks it, and it's either by minutes and it's spontaneous. And the thing is, code black just doesn't happen. We ramp up and we ramp down. But I want to make the reassurance that we are watching it. We watch it constantly so that we are prepared. So when it does hit, we can look at our partners, our mutual aid, and try to prepare for it before it even happens. The other impact that we're having with healthcare system is we're having difficulty staffing. Hospitals are having difficulty staffing. All healthcare sectors are having problems staffing, and that is not a local issue. That is a provincial, national, international issue across the board in the healthcare system. To be honest, people are tired, and that is the issue with our human health resource staffing levels. In conclusion, to say that Essex-Windsor EMS, it's been challenging, but call volumes appear to be maintaining historical growth of the 2 to 3% range. Response times have been affected by COVID in a negative fashion, but appear to be on the rebound. Ambulance offload delays have increased, but due to these unforeseen pressures, I can't see that coming. I don't know if anybody can predict that. We've maintained its focus throughout the last 2 years, following the guidelines of the master plan and putting different pieces into play. To say that Essex-Windsor EMS has not been affected by COVID-19 would be false. To say that our impacts of service delivery were brought on solely by changes within Essex-Windsor EMS are totally false. To say that Essex-Windsor EMS is planning, changing, altering course based on clear evidence, historical data, and experience is true. Charting the course and navigating COVID-19 has not been easy, but we've made the journey. We're preparing the 2022 budget as we speak, and I'll be addressing different needs that will come before you so that we can make sure that we have a very safe, secure, effective, and efficient service moving into the future. There's no financial implications with this report. It's strictly information. Mr. Warden, I'd welcome any questions or comments.
Thank you very much, Chief, for your in-depth, certainly report and basically bringing a sense in terms of the global picture. And I think this is it's not one singularity within the system, and it's not unique certainly to us. Your report really covers in depth every aspect of the EMS service within our community, and rest assured that council are very supportive and understand the difficulties that we're all faced with in dealing with the pandemic and all the supposedly other issues that certainly affect the service and that. So I certainly want to commend your leadership, Chief, and certainly the deputies and the district chiefs out there, the supervisors and staff. That we're very fortunate in Windsor Essex that we've got great leadership and in dealing with that. And I know you've never been shy about bringing, if you needed resources, you were always front and center and very upfront with us at budget time and so forth. And we had the opportunity to deliberate and question and so forth. But I do realize negotiations sometimes can be a little tricky and so forth. So I certainly want to commend you for actually an in-depth report. And I would like to see that report on our website for the general public, or even for that matter, the media to look at, because a picture tells a story, and it shows that you've been able to target areas within the system to beef it up in areas where it needed, and to allocate the resources where they're greatly needed, so certainly I want to commend you for that. But I think it should be on our website, available for the general public and certainly the media to have a look at it. And I think bits and pieces of that should go on our social media site for the county. And I think information is a great tool if it's done properly and if it's done factually. And so I think it's an opportunity for us to take that report, put it out there so that obviously the story can be told with facts and not fiction. And so with that, I'll certainly open it up with with members of council if they have any comments they want to add. Mayor Bondi.
Thank you, Warden. You said it so eloquently, and you can tell when the chief speaks, he has passion in his words. This is not just a job where he's going through the motions and says, oh, I have to give a report to county council. We hear it, we see it. You made comments I wasn't aware of. I just spoke to my doctor a couple of days ago, and you're right, it was on the phone, but I could see some people saying, the heck with this, call an ambulance. And the offload delays, I'm sure everybody knows I have a daughter who works in ER, and it's terrible what's going on. So I agree with the warden, it should be on the website. I just make one comment that if you do correct that 5-year average before it goes on. But thanks for what you do, appreciate it. It's hard to find good, dedicated people, and I'm glad we have one of the best leading the team. Thank you.
Thank you.
Deputy Mayor Richard Malash.
Thank you, through your worship, to Chief Krauter. So Chief Krauter, great report. And I do understand, and you've said it very well in the report, that all of our health sector has been and will continue to be under a very heavy workload, almost not even being able to keep up to what we have coming forward. So I know you did mention briefly Code Black, and you and I have had many conversations in the last little while about Code Black and Code Red. I believe that you're doing the best that you can to try and combat this. And I'm just wondering, with all of this happening, we know that, as you mentioned, that it's happening all across the province and all across the nation, all across the world for that matter. But more local to our province here, has there been any discussion at the provincial level with regard to Code Blacks and Code Reds, and any solutions that the province maybe is looking to put in place to get a resolve on this?
We've had discussions both with the Ministry of Health and Emergency Health Services branch. And at this time, the answer is if for funding levels, if we need the funding to combat anything COVID related, we put in for that and it's covered. And I stated that we're trying to staff with upstaffs or overtime. We just finished a recruitment of 14 people and brought them on board, and we're getting ready to post for another recruitment. We have talked at the ministry levels. The problem is they can offer the funding, but if we can't find the human resource, it's very difficult. As you're aware, we have the COVID response and stabilization team, which Essex-Windsor EMS and Erie Shores Healthcare have partnered with. We have one paramedic that's dedicated to that team on a more logistical piece. This past 4 weeks, Toronto brought in, I believe, 8 or 10 healthcare workers to assist with vaccinations. That takes the burden off of us. We brought in through that CREST team, I'm sorry for the acronym, but through the CREST team, we brought in the Canadian Red Cross, and they've set up camp out in Leamington to help with vaccinations. So the province has stepped up both with funding, but the problem is the health human resource and the backlog of healthcare. It's a very hard battle to look at. If you look, and I don't want to go off on a strong tangent, but if you look at Saskatchewan and Alberta right now and the pressures that they're feeling due to maybe the way they did not handle the summer, but their healthcare system is overrun right now, and I cannot advise any more of how important vaccinations are and how to manage that. But to answer your question shortly, the province has stepped up. The problem is trying to get the health human resource to staff.
Okay, thanks, Chief Krauter.
All right, any further questions, comments? Yes, Mayor Santos.
Thank you, Warden, and through you to our chief. Chief, I just want to go back to page 4 on your report, and you speak about the times and trying to meet the different levels. And you've identified, obviously, the supports that are there with the tiered response agreements throughout to the region and our neighbors. Speaking to the statistics, are those, I guess, the number of times that those agreements come into play, are those included with the stats that you're providing with us, or is there a separate reporting for the number of supports that are brought in?
So I'm confused on the question. I'm sorry, Mayor Santos. The tiered response agreements you're asking about? Right.
So on the chart where you're speaking of response meeting, whether it's the 75% target or 55%.
Oh, okay. Yep.
Right. The stats you're showing, are those just EMS stats, or do those include the times when tiered response is active? Do we get the times from those tiers, whether it's another fire department responding? Are those stats included within your chart here?
Yeah, the only time that fire tiered response is put into the chart is for the sudden cardiac arrest calls. That's the only time that tiered response agreements are included in the response time standards data. And then the average response times, we don't include the fire department tiered response just because of there's a gap in collecting that data, and we're trying to close that gap so we have that clear picture.
Okay, thank you. And then just supplementary, the other point I wanted to draw attention to, and really appreciated seeing the charts that you had on page 7 and 8, the purple lines, the bars, and the call volumes. I think if you stay more effective, we can put it side by side instead of 2 separate pages when we're trying to communicate what that change of service or scheduling for staffing has done. I think it is truly reflective of what has the experience been, and I think it did pretty well and said it best in terms of you can't predict call volume and when those will be coming, but certainly if you built in a little bit of a buffer with where the purple bars are rising, where coverage is provided, I think that's information that is we should be sharing, and I agree with fellow members of County Council that this is the continued monitoring of the service that's being provided by EMS and how it needs to shift in accordance with the calls. And I think this is a prime example of how that's working. So thank you for that.
Thank you. I take your suggestions. I'll talk to Ms. Birch and to communications and see how we can get this report so it flows better if we put it up on our website.
Any further questions or comments to Chief Krauter? If not, then a motion to receive the report. Mayor Bondi and Mayor Bain, all in favor? Opposed, if any? That is carried. Thank you very much, Chief.
Thank you.